Hey, everybody. Welcome in. Thanks for coming. All right. See a few more logging in. Welcome, everyone. Want to thank you for registering to join Medicare 101. I know that you are being inundated with mail and phone calls, texts, people knocking at your front door. So I appreciate you registering to come. And our goal is to leave with more answers than questions. So if you haven't already, grab some notepad and scratch paper and a pen, and we will get going. If you're not a note taker, don't feel bad. You can email me. My email is ncurry@healthbrokerfl.com. If you just shoot me a quick email, I'll be happy to email you this entire slide deck, the entire presentation. That way you have it. You can also call or text me. It's 386-401-5644. And just text me or email and just say, hey, send me the slides, and I will be happy to get that out to you. So let's just wait a few more seconds. I still see a few people jumping on, and then we'll get right into this thing. I want to be respectful of your time. Try to keep this around 30 minutes or so. But I know that a lot of people, have to jump off. Life happens, things happen. So if you have to jump off, again, my email's ncurry@healthbroker.com. Just shoot me an email. We can set up a one-to-one appointment and go over all this on a one-to-one basis. All right, got some water. Let's kick it off. All right, so the first slide is Meet Nathan. Hi, I'm Nathan Curry. So I'm a proud husband and father of four. That is my family there. We went up to Pennsylvania, to Pittsburgh, and last summer and caught a couple Pirates games, and Pirates actually won that game. So it's not something you can say too often as a Pirates fan. But those are my four children. That's my wife. She's the short one there on the left, the brunette. So I am the agency owner of USA Benefits Group. We are headquartered here in Daytona Beach, Florida. I got out of the dreary gray Pittsburgh weather and came down to sunny Florida, and I've been down here for 20 years now. So I am a Medicare and retirement specialist, and I am actively involved in my local church ministry. I enjoy doing that. And this is my team. We are an education first agency. So our first goal is to educate you on your options. That way you make an informed decision. A lot of the decisions you're going to make regarding your Medicare are lifetime decisions. So it's very important that you understand what's available to you and the gravity of your decision. So that is our goal, education first. Even if you watch this seminar and you go with another agent, that's fine. I mean, we really want you to understand what you've got before you. We have carrier and provider experience. So Elaine, which is the tall blonde in the middle, she worked for the second largest Medicare insurance company in the country for over 20 years. She brings all of that knowledge and experience to our customer service team. Lindsay, who is standing beside her, the blonde, and Donna, beside her, they both worked at a Medicare primary care office for over 20 years each. So they bring all that provider knowledge, claims, billings, etc. So, there's not a whole lot that we can't help you with or haven't seen. And I am licensed in 35 plus states. If you're in one of the 15 states that I am not licensed, that gentleman sitting there beside me, Raymond, he will be your agent. So we kind of split it up. And we do offer in-person and digital learning. And again, over 50 years combined experience with Medicare. And we are independent. We represent multiple carriers. And we are dedicated to ongoing client support year after year. We don't just sign you up and you never hear from us. We do stay in touch with you throughout the year and, of course, during the open enrollment period. We are an A-plus rated brokerage firm with the Better Business Bureau. And I'm a proud BNI member, Business Networking International. Been involved in that for many, many years as well. And you can see that we have over 200 five-star Google reviews, and we hope that you become the next one. All right, so Meet USA Benefits Group. So we do make it simple and convenient to meet with us. Obviously, if you're in the Daytona Beach, Central Florida area, you're more than welcome to come directly to our office in South Daytona. If you're within 90 minutes of our office, we'd be happy to come to your home and do this at your kitchen table. And for most of you, we will have to do this via phone or a Zoom meeting. And we are very active on social media, Facebook, YouTube, Instagram, and LinkedIn. So please give us a like and follow on social media. And that picture there at the bottom, that's a Medicare seminar I did a couple of months ago in Daytona. Had a really nice turnout there. So, all right, so we're going to get right into Original Medicare. So Original Medicare consists of two parts, Part A and Part B. People say, I have Part A. Well, you have Part A. In order to be considered Original Medicare, you have to have A and B. And Medicare Part A is premium free. As long as you've worked for 10 years, 40 quarters, paid your FICA, you are entitled to Medicare Part A at no cost. Medicare Part A covers the hospital, the building, the facility itself. It also covers the hospice, skilled nursing, and home health. But overall, it's hospital coverage. Part B, I always tell people, if you take the roof off the hospital, turn it upside down, everything that falls out's under Part B. So that's your doctors, your specialists, your surgeons, medical equipment, even medication that's administered by a physician goes under Medicare Part B. And Medicare Part B is not free. A lot of people think that it's free, but Part B does have a cost of $202.90. That is the standard Part B premium in 2026. And unless that you have a higher income, this is known as IRMA. IRMA is an acronym. There are no shortage of acronyms when it comes to Medicare jargon. IRMA stands for Income Related Monthly Adjusted Amount, or IRMA for short. So if you are a single tax filer, you made over $109,000, you will have the privilege of paying more for Medicare. If you were 109 or less, you'll pay the standard Part B premium. If you are a joint filer, if you are over 218, you will also pay more for Medicare. So about 10% of the Medicare population, which I believe it right now is around 53 million people on Medicare. So about 10% of those do have to pay the higher IRMA rates. So Original Medicare enrollment scenarios, we're going to go over these each individually. So scenario 1 is you are on Social Security. Scenario 2 is you are not yet receiving your Social Security benefits. And scenario 3 is you are still working and covered by your employer plan. So scenario number 1 is if you are on Social Security, this is the easiest scenario, you're going to automatically be enrolled into Medicare. You'll receive your Medicare red, white, and blue card approximately 100 days before your 65th birthday, and they will automatically deduct the $202.90 directly from your Social Security benefit check. Okay. Scenario number 2 is you are currently not on Social Security. If you are not on Social Security, you are not covered by a group health plan that has 20 or more employees. You need to sign up for Medicare to avoid being penalized. 4 ways you can do that. Easiest way is the first option online. ssa.gov/benefits/Medicare. You have to verify your identity. They added new security features this year. You got to take pictures of your driver's license, got to take a picture of yourself. Once you get through all that, you'll get access right to the application. Pretty simple, pretty streamlined. Generally within 3 to 5 business days of you submitting that, you'll have your Medicare number. Now you won't have your card, but you can go into the Medicare system and pull your Medicare number. We can. The second way to do it, the second easiest way, if you will, is the National 800 number for Social Security, 800-772-1213. They will not sign you up on that phone call. They'll schedule you a phone interview, generally a couple of weeks after you make that initial phone call. They'll call you a couple of weeks later. You get it done over the phone. In person, I always tell people, call your local Social Security office first. A lot of offices have not returned to letting people come in person since COVID. So check with your office before you show up. And then, of course, you can always fill out the appropriate paperwork and mail it into Social Security. A lot of Social Security offices have a drop box that you can drop it in, and they check that drop box every day. Since you're not on Social Security, they will bill you quarterly for your Medicare premium. Again, it's $202.90 for most. They will bill you $202.90 times 3, so $608.70. If you don't want to pay quarterly, you can go to Medicare.gov. After you get your Medicare number, you'll be able to go to Medicare.gov. You'll log in with the same credentials you use for Social Security, SSA.gov, and you can pay monthly via credit card. You can log in each month and pay with your credit card. You can also sign up for what they call Medicare Easy Pay, but that has to be used with your bank and routing, and they will draft your Medicare premium on the 20th of each month. You cannot use your credit card for auto pay. You would have to log in each month and pay with your credit card if you want to go that route. So scenario number 3 is if you are still working and you're covered on your employer plan. So you have the option. You can enroll in Medicare effective your 65th birth month, or you can delay your Medicare Part B until you retire, and then you can get your Part B at a later date. So if you decide to delay your Medicare enrollment, highly recommend you sign up for Part A. It's not the end of the world if you don't, but if you sign up for Medicare Part A, it is a lot easier to enroll in Part B down the road. You can do everything electronically. If you don't get Part A, you have to go in person and take care of all of that. So 9 times out of 10, Medicare is usually less expensive and offers better coverage than your employer coverage. However, if you're still working and you have a spouse that's younger, you have to worry about waiting for them to get onto Medicare. Every situation is different. Best thing to do if you're in that scenario is just book an appointment with us, and we can just weigh out all your options and see what's going to be the most advantageous. But if you are 65, you have no intention of retiring, best thing to do is just sit down, go over your employer plan, how much it's costing you each paycheck, compare it to Medicare. Like I said, 9 times out of 10, Medicare is going to be less expensive and better coverage. And that way too, if you want to work for another 3, 4, 5 years, when you do go to retire, you don't have to go through the CMS documentation proving you had credible coverage. You're already in, you're done, just retire and walk away. Medicare is already taken care of. So original Medicare will start the first day of your birth month. So if you're born on July the 30th, like I am, your Medicare will start July the 1st. However, if you're born on the 1st of the month, so July 1st, your Medicare would actually start June 1st. So people born on the 1st get a free month. It's not free. They're still going to charge you. A month early, I guess I should say. And then once you are enrolled into original Medicare, there are major exposures under original Medicare. A lot of people think that Medicare covers everything. It definitely does not. You still have 6 major gaps in original Medicare. That's why most people choose to not stay in original Medicare. They'll either choose to do a Medicare Advantage plan or a Medicare Supplement plan. So under original Medicare, the big 3 gaps under the A side is your Part A deductible, which is $1,736, and that is per occurrence, per benefit period. That is not a one-time annual. And then while you're in the hospital, you have your daily hospital copays, and then Medicare does not cover the first 3 pints of blood. So those are the 3 big gaps under A: deductible, copays, and blood. And then under the B side, your doctor side, you have an annual deductible of $283, and that is a calendar year one-time deductible of $283. Once you satisfy your deductible, you still have 20% coinsurance. So you're on the hook for 20% of the bill, and there is no max out of pocket. And then the other gap that you're exposed to is what's known as the Part B excess charges, and I will go over that in more detail in a later slide. So here is the heavily contested debate: Medicare Supplement versus Medicare Advantage. I get this question all the time. What should I do? What do you think's better? And if you book a one-on-one appointment, I will tell you my true opinion. But for the sake of this, I'm staying neutral, unbiased. I think by the end of this presentation, you will have a clear idea of what's best for you. And there is no right or wrong plan. It's really based on your situation. Your income, your health, things like that. So it's a 2-item menu. You have original Medicare, you have 2 options. You can choose to stay in original Medicare. You pick up a gap plan to fill in those 6 gaps we just talked about. Pick up a separate drug plan as well if you go with the Medicare Supplement route. Or you can enroll into a Medicare Advantage plan. It rolls everything into one ball, one package, Your hospital, doctors, dental, vision, hearing, all that's enrolled into one package called Medicare Part C or Medicare Advantage. Okay. So like I said, it's a two-item menu. You want to do Medicare Supplement or Medicare Advantage. Now, depending on what side of this chart you land on, there's a ton of sub options, right? There's a ton of companies that offer supplements. There's a ton of companies that offer Medicare Advantage. But your first major decision is which one do you want to do here, Medicare Supplement or Medicare Advantage? So we'll compare the two side by side. Medicare Supplement, you're going to pay your $202.90 to the government, okay? Plus, you're going to pay for your supplemental on top of that. And the price is, depends on your zip code, your county. So if you book an appointment with me, email me, I'll be happy to plug in your zip code. I can send you the prices for all the various insurance companies based on where you live. As far as coverage, you're going to have your lowest out-of-pocket costs when you see a doctor, right? So you're going to know pretty much exactly what your healthcare is going to cost for the entire year if you go with a Medicare supplement. You are essentially prepaying for your medical expenses. Point number 3 is the main reason people choose a Medicare supplement. You can go to any doctor at any hospital in the country. No referrals are required. There's no networks. So if we sit down and we go over Medicare supplements, I'm not even going to ask you who your doctors are. You go to any doctor, as long as they take Medicare, which all of them do, except for maybe pediatricians. If you go this route, you will need a separate drug plan, Part D. So very important that we go over your medications and make sure that you get that box checked, you get your drug plan taken care of. The other option would be your Medicare Advantage plan. So you're still going to have to pay your Part B premium, the $202.90, plus your Advantage plan. Most Advantage plans do not cost anything. Most of them are $0 premium. There are several companies that even offer a Part B reduction, so they may pay a portion of that $202. So if your goal is to get onto Medicare, keep as much money in your pocket as possible, Medicare Advantage plan all day long. However, when you go to your doctor, you're going to have higher out-of-pocket costs, right? You're going to have potentially deductibles. You'll have co-pays, things like that. Very similar to the Affordable Care Act or your group health plan at work. And if you go with an Advantage plan, you're going to have a network. So if you're in an HMO, you're going to have to stay within that insurance company's network of doctors. If you choose a PPO, you're not going to have referrals. However, if you go out of their network, you're going to pay more. So again, very similar to your employer coverage or your Affordable Care Act coverage. The benefits are your Part D is going to be included with your Advantage plan, and those extra benefits that you see advertised on TV and all the mail you're getting, the dental, the vision, the hearing, those are also included. Those are not included with a Medicare supplement. So comparing the two side by side, again, the point number 3 is the main reason why people choose a Medicare supplement. So they don't have to deal with that network, doctors not renewing their contract with that insurance company. That is all alleviated with a Medicare supplement. You're in complete control of where you go. So this is also something that we highly recommend that you consider purchasing, whether you do a Medicare Advantage plan or a Medicare supplement plan. Cancer, heart attack, and stroke coverage, You will have out-of-pocket expenses if diagnosed with cancer that Medicare does not cover, and that's with a Medicare Advantage or a Medicare supplement. How much varies per diagnosis and treatment path, but I'll give you a great example. I had a client that was diagnosed with, she had to have bone marrow transplant, essentially in Mayo Clinic in Jacksonville, which was 2 hours from her house. And she had to be within, I think it was 30 miles of the hospital while she was undergoing this treatment. Well, Medicare is not going to cover that Airbnb or, that rental. So that cancer policy really comes in handy to cover all those unforeseen expenses. A lot of prescriptions that are still deemed exploratory. They're not covered by Medicare on a formulary. Well, you'd have to cash pay if you don't have a cancer policy. So for those reasons, we definitely encourage you to consider adding a cancer, heart attack, and stroke plan to your Medicare coverage. They're not expensive. My wife and I personally have $75,000 cancer policy on each of us. So. Also want to touch on skilled nursing. There's a lot of confusion around how Medicare covers nursing coverage, skilled nursing. So this is how it works. If you go into a skilled nursing or what they call a SNF, the first 20 days are covered at no cost. And that's whether you're on an Advantage plan or a Medicare Supplement. First 20 days are covered at no charge. If you're in there beyond day 20, days 21 through 100 are $209.50 each day. And then after day 100, you're responsible for all costs. So you're either going to cash pay or you're going to have a policy in place that picks up those extra days. And I always like to point this out. This is right in the Medicare and You handbook. I know this one's from 2024, but if you look at the 26 book, it's still on page 28. It hasn't changed. So it says Medicare only covers a skilled nursing facility after a 3-day minimum medically necessary inpatient hospital stay. So in order for Medicare to even cover a stay at a skilled nursing facility, you had to have a 3-day minimum hospital stay. If you go on to read further in the paragraph, they will only continue to cover you in a skilled nursing facility if your health is improving and not declining. So there's a lot of stipulations on how Medicare covers that. And again, that's why we recommend that you have a plan in place in case you can't meet their requirements and have that covered. So we have curated a few umbrella policies. So you can see, the first line on all options is your Medicare plan with prescription drug coverage. Of course, we always recommend you add a cancer, heart, and stroke policy. Umbrella number 2 is that your Medicare plan, your cancer, heart, and stroke policy. If you're doing a Medicare supplement, they do not cover dental, vision, or hearing. So, that would be an ancillary policy if you'd like to add that coverage. But if you do a Medicare Advantage plan, we highly recommend those HIP plans. HIP is another acronym. It stands for Hospital Indemnity Plan. So essentially, if you're on an Advantage plan, you're going to have a daily hospital copay, right? It might be $400 a day for days 1 through 7 in the hospital. Well, those HIP plans take that away. They'll also take away the days 21 through 100 for skilled nursing. And they're inexpensive, around $30 a month to mitigate that risk. So if you're thinking Advantage, highly recommend you consider a HIP. And then you can see umbrella number 3 is cancer, heart, and stroke, dental, vision, hearing, or a HIP, and recovery care. So recovery care policies are incredible. They're not available in all states, but the states that, if they are available in your state, we highly recommend you consider that. They also cover the skilled nursing care, and they will also cover home health care. So for nurses' aides to come into your home to help you with light chores, meal prep, laundry, things like that. And you can choose how many days per year they cover. They're very inexpensive, and they are, if you ever had to use it once, it's going to be worth its weight in gold. Option number 1 is, again, Medicare Supplement. We're going to do a deep dive into both Medicare Supplement and Medicare Advantage. We're going to kick it off with Medicare Supplement plans. And again, you have those 6 gaps in your original Medicare. That's why most people choose to not stay in original Medicare. They choose to either supplement it or go Advantage. So it would work like this. If you choose to go with the Medicare Supplement, Medicare is your primary insurance. A and B pays first. Whatever your Medicare A and B does not pay, your supplemental picks up. And then, of course, you would have that standalone prescription drug plan, that Part D that you would show at the pharmacy. So if you choose to go this route, you're going to have 3 cards in your wallet. Okay. And it's a very streamlined process. So what I mean by that is, your provider, your doctor only bills Medicare. Medicare automatically sends what they don't pay over to your supplemental company. So it's not like, you're going to be, waiting for claims to be paid, that you receive it. It's a very streamlined process. If you choose a supplement, once you log into your Medicare.gov account, the supplement company you chose will be showed in your Medicare file, your Medicare.gov file. And you really should never have any problems with claims or billing. But if you do, we're here to help. So all Medigap plans are offered through private insurance companies. Okay. So, and we'll get into this on a later slide, but they're all offering the same product. Right? They're federally regulated. So, company AARP doesn't offer a different Plan G than Blue Cross Blue Shield. It's the same product. So this is the Medicare Supplement chart. Took this right out of the Medicare and Me book. You can see I have Plan C and Plan F in red because unless you were born prior to 1955, they are no longer available. They're phasing those out. You may have some friends or family or neighbors that are on those, but you can no longer get that if you're born after 55. You can see that there are 8 that are available to you, and the 2 highlighted in yellow, the G and the N plan, are really the only 2 supplements that we see people enrolling in today. In fact, if you're considering a K, an L, an M plan, I would honestly say you're probably better to do a Medicare Advantage plan. You'll have lower out-of-pocket costs. So for this illustration, we are just going to pretty much just hone in on the G and the N plan. Again, if you're interested in any of the other supplements that are offered, just go ahead and shoot me an email, book on my calendar, and we'd be happy to go over those with you in more detail. But again, Plan G is the Cadillac plan. That's the best supplement that you can get. And the number one question is, how much does it cost? So Plan G ranges based on where you live. So you give me your zip code, I will send you a quote. Yesterday my first phone call was a gentleman in Lynchburg, Virginia, turning 65. It was $109 a month for a Plan G, no tobacco. I just got off the phone with somebody in Florida. It was $205 and change. So again, that zip code is super important. And like I said, you can email me, call me, text me, and I'd be happy to send you some quotes based on your zip. So Plan G, going to range anywhere from 100 to 200 or more. I was on the phone a few days ago with somebody in New York City. Supplements in New York City are $370. It's crazy. But for most of the country, between $100 to $200 is normal, is average. So a Plan G, if you choose to go with the Plan G, it's going to cover 5 of the 6 gaps that are in Medicare. The only gap that it does not cover is that annual Medicare Part B deductible. So if you choose to go with the Supplement G plan, you're going to meet your $283 calendar year deductible. After that, 100% of your medical Medicare approved expenses are zero. Not a bad deal. Not a bad deal at all. And the N plan, I think the N plan is a strong plan. You should definitely consider it. I tell people all the time, if I was going on to Medicare today, I would probably do an N plan. Don't see the doctor very often, save a few bucks. So the N plan, it covers 4 of the 6 gaps that are in Medicare. Just like the G plan, under Plan N, you still have to meet your calendar year deductible, $283. Once you satisfy that deductible, you still have $20 copays at the doctor visits, specialist or primary. You would also have a $50 ER copay. Of course, they waive that if you're admitted to the hospital. And then the other gap that N does not cover is called the Part B excess. I'll quickly go over that. So every doctor in the country who accepts Medicare accepts the Medicare fee schedule. It's called the RVRBS. They are allowed to charge 15% above what Medicare pays them. So this is just the doctor or the surgeon. This is not the hospital. This is just the physician. So if Medicare, for example, gives the surgeon $1,000 to do carpal tunnel surgery, he would take that $1,000 and he would be able to bill you 15% on the back end, so $150. With that being said, 98, 99% of doctors do not charge it. Most doctors don't even know what it is. We do see it. Mostly we see these being charged at your specialty clinics, Cleveland Clinic, Mayo Clinic, Shands, etc., Moffitt Cancer Centers. Some of their providers do charge it. I tell people, if you do an N plan, the simple thing to do is just ask, say, hey, I'm on a Plan N. Do you charge the Part B access fee? Most doctors, like I said, don't even know what it is, but some certainly do charge it. But I still think N's a great option to consider. And again, it's approximately $40 less per month than the G plan. Generally, it saves you, $400 to $500 a year on average by going with the N plan. Question I get all the time: if I start out with an N, can I go up to a G? You can, but you have to go through underwriting. If I start out with a G plan, can I go down to an N? Yes, you can, without underwriting. So something to consider. All right, key points about Medicare supplements. This is a very important slide. Best time to enroll is 6 months prior to your birth month. Generally, most people like to get these done as soon as possible just to kind of check it off their list. But the main reason we suggest doing it 6 months early is you lock in the cheapest rate. right? The joke is, when's the best time to buy life insurance? Well, yesterday, right? The rates never go down. They have increases annually. When you lock in as soon as possible, you lock in that rate for your first year. So it happens a lot. People, I'll send somebody a quote, they'll email me back 2 months later, and it's gone up. You know, and that is the truth. There's nothing we can do about that. But you have 6 months before and 6 months after your 65th birth month. You have a year in total to purchase a Medicare supplement without any health underwriting. Okay. After that period, 6 months before, 6 months after your Part B effective date, if you miss that window, you have to answer 30 health questions. And depending on how you answer them, you may never get a Medicare supplement. Okay, so it's very important. If you're on the fence, you definitely want to make sure you hit that deadline and get in there before your open enrollment window shuts. And another thing to point out is, and I mentioned this earlier, is that this is all standardized. So these supplements are all federally regulated by the government. The letter of the plan, not the company offering it, is, so what I mean is Plan G is Plan G. Like I said, United Healthcare is not offering a different Plan G than Blue Cross Blue Shield. It's the exact same thing. So what we look at is stability, right? We look at, what have your rate increases been over the last 10 years? What's your AM Best rating? What's your S&P rating? What's your loss ratio? These are all very important things to consider when choosing a Medicare supplement plan. And again, this is just a small snapshot of our product offering. We have over 50 companies that we can compare. So again, we're brokers. We have every plan option, and our recommendations are always unbiased and in your best interest, because again, no matter what company you go with, it's the same commission to the agent. I like to, I already expelled one of these myths, but I like to throw these in there because I hear these questions all the time, and rightfully so. The legitimate questions. So it says, I must have to pay a fee to use a broker and get help with all this. And the truth is, we charge you no fees of any kinds for our service. Myth number 2 is nobody works for free, so the insurance companies must charge a higher price if I go through a broker like you. And the truth is, you will pay exactly the same price whether you use our help throughout the process or you do it alone. The insurance companies pay us directly for educating you and helping you enroll. Myth number 3 is if you get paid by the insurance companies, you must have a bias towards one company or the next. And the truth is, we have access to over 50 different insurance companies, and they pay us the same, whichever one you choose. So we are not biased. We will never steer you towards a company because it benefits our pocket. So again, truth number 1, no fees charged of any kind. Truth number 2 is you pay the price. You pay the same price if you go directly to the insurance company or if you use an agent. And we have over 50 companies to choose from, and we are not biased. We genuinely look out for your best interest. I always like to throw this slide in there. A lot of people are not aware of the various federal and state assistance programs. This may not apply to you, but if you have somebody that you know in your life, a friend, family member who's struggling with Medicare premiums, Medicare drug costs, a lot of people are not aware that there are federal and state assistance programs. We will help those folks apply for those programs. And again, our services are absolutely no cost. So if you know somebody that could benefit from those services, please send them our way. We'd be happy to help. So we're just going to quickly glance over prescription drug coverage. So again, it's the third pillar of your Medicare supplement, right? You have your original Medicare, your supplemental. You also need to pick up that standalone drug plan. The reason you need to get a drug plan is because if you do not enroll in the Medicare prescription drug plan, they will penalize you in the future when you decide to enroll. And how they calculate that penalty is it's 1% for every month that you could have had it. So they go off the national average. So they go off all the drug plans in the country. They go off the median price, and they charge you 1% of that every month that you could have had drug coverage. Most states have a $0 drug plan. I always tell people, if you're healthy, you're just on a couple of maintenance generic medications, just take that $0 drug plan, check that box. We can always choose a new drug plan every year during open enrollment as our needs change. And then the other thing, I want to go over is Medicare has capped your out-of-pocket cost at $2,100 on prescriptions. So you could be on 20, 30 different medications. The most you'll have to pay in a calendar year is 2,100. And you can even break that up. So you can pay like 170 a month directly to the insurance company. Then when you go to the pharmacy, you would pay nothing. But the caveat there is that medication has to be covered by that plan's formulary. So it's very important, and that's why we have our Part D process. So we would input your drugs into our Medicare online calculator. You tell us your pharmacy. We compare all the plans available in your zip code, and then we help you enroll in the plan of your choice. And then, of course, we reevaluate this every year during open enrollment to make sure that's still the appropriate plan for the next year. So just want to recap original Medicare because we're going to be getting into a Medicare Advantage next. So original Medicare, Medicare is your primary insurance payer. I need to update that slide because in 2026, the Medicare Part B premium is $202.90. It was $185 last year. So you're going to have your $202.90 plus your Medicare Supplement, which varies by zip code, but you're looking at an additional $100 to $200 depending on where you live. And then you're going to have your prescription drug coverage. The monthly premiums, like I said, there's some that are $0 monthly premium, and those will range in price anywhere from $30 to $50, even up to $100 a month, depending on what medications you're currently taking. So now we're going to get into option number 2. Get ready for this. All right, so option number 2 would be your Medicare Advantage plans. So if you do a Medicare Advantage plan, you are now in managed care. So what happens is you are no longer in original Medicare. You do have to stay enrolled in A and B, but Medicare is no longer your primary insurance payer. Medicare pays whatever company you choose to enroll in. They pay them every month to manage your health care. Okay. Now, the Medicare Advantage plans must be equally as good as original Medicare, and they do include your prescription drug coverage. So, no need to enroll in a standalone drug plan that's going to be integrated in to your Medicare Advantage. Most plans are $0 monthly premium. As I mentioned earlier, a lot of companies out there will offer to reduce that $202.90 Part B premium. So again, if you're looking to get onto Medicare, keep as much money in your pocket as possible. Medicare Advantage plans are going to help you do that. But they're going to be very, very similar to your group health plan or the Affordable Care Act, right? You're going to have your copays for doctors, hospitals, MRI. You're going to have deductibles. Some plans have deductibles, some plans don't. Some plans have co-insurance for certain covered services where you'll pay a percentage of that procedure, but that you will have a maximum out of pocket. So, Medicare Advantage plans, they have their place. It's certainly better than being on original Medicare for that simple fact alone. A Medicare Advantage plan has a maximum out of pocket, maybe $4,000, $5,000, $6,000. Again, depends on where you live. But original Medicare has no maximum out of pocket. So at least it kind of puts that cap with a Medicare Advantage plan. And again, we always recommend an umbrella policy, hospital indemnity plan. Certainly, if you do a Medicare Advantage plan, highly recommend you consider that. So choosing an Advantage plan, it's, we sit down, first thing we do is input your zip code. It's going to pull up all the plans available in your county. Next thing we'll do is go over your doctors, right? Because Medicare Advantage is network-based. We want to make sure the doctors that you see are in that network. If there's a hospital system that you would like to remain in or use, again, we'll go over those hospital systems in your area and make sure they're going to be covered. Medication, same thing. We want to make sure those medications are covered by that formulary. If we do a Medicare supplement, we're not even going to ask you about your doctors and hospitals because as long as they take Medicare, you're good to go. And, the Medicare Advantage plan are going to give you those extra benefits, that gym membership, the silver sneakers, your dental, your vision. A lot of plans still offer over-the-counter, your vitamins, cough, and cold toothpaste. There are also plans that are called C-SNPs, chronic special needs plans. These are plans that are specifically curated for people with chronic conditions like asthma, COPD, diabetes, cardiovascular disease. So if you know somebody who may qualify for a C-SNP, that would be a great referral for us. They offer enhanced benefits, better drug coverage, things like that. So, even if that's you, we would definitely want to at least go over those chronic special need plan options if you would qualify. All right, so your initial enrollment age for Medicare Advantage it's the 313 rule. So you want to get signed up for your Medicare Advantage plan 3 months before, the month of, or 3 months after your birth month. And then again, I always tell people you're not married to a Medicare Advantage plan. We have the opportunity to switch that every year during open enrollment, October 15th through December 7th. Every year, if you do a Medicare Advantage plan, every year in September, you get what's known as an ANOC. It stands for Annual Notice of Change. So essentially, it highlights any changes to your plan, good or bad. And then from there, we generally follow up with an email and a text message saying, hey, you should have got your ANOC. If you reviewed it and you don't like what you see, let's schedule an appointment. But if you do like what you see, the plan's heading in the right direction or getting better, you don't have to shop every year. You can certainly, it'll auto renew, but you have the option to shop or just let it ride. So again, just want to go back to compare the Medicare Supplement versus the Advantage. Again, your Part B premium, you're going to have Medicare Supplement's going to have lower out-of-pocket costs when you go to your doctor or hospital, but you're going to have that higher monthly cost, right? Again, network, any doctor, any hospital, no referrals. It's huge. Medicare Advantage, you're going to have your 202. Some companies can reduce that for you, again, based on where you live. But when you go to the doctor, you're going to have you're going to have co-pays, you're going to have co-insurance, you're going to have deductibles, things like that. And then, of course, your network, you're going to be limited to that insurance company's network of doctors in your area. But you're going to have your drug coverage included. Your extra benefits are also included. Again, we do recommend that you consider one of our umbrella policies, whether it just be a cancer policy or hospital indemnity or the recovery care. I also do retirement protection. So if you have a 401k, if you have a SEP or a Roth or traditional, a 403b, or if you have a market-driven account, mutual funds, individual stocks, if you've just got a lot of liquid assets, if you have CDs coming due, we can help you move that into an annuity. I've been doing these for many years. If you are interested in a illustration on an annuity, you'll deal directly with me. There are some phenomenal products out there right now that are offering a 30% income bonus. So if you come in with 100,000, they put 30%, 130 day one. Right now they're offering guaranteed. Some companies are even offering up to 9.5% guaranteed compounding growth. So there's some really strong products out there right now, which a lot of people find advantageous, especially during these uncertain times right now with the market. With an annuity, your principal is 100% protected from loss. So it's guaranteed black and white paper that you will never lose a dollar. Even if the market loses 20 points, you will still get your guaranteed rate of return. And you can choose from fixed rates with fixed or indexed rates for larger. We recommend generally fixed indexed annuities. And you will have income for life. So once you annuitize or turn on that income stream, you can never outlive your money. And of course, that also can be left to your spouse and or a beneficiary if you don't have a spouse. That can be left as it's a life insurance contract at the end of the day. So we have a three-phase system. So essentially, phase one was you saw our ad on Facebook or however you found us. You've joined today's educational seminar. Maybe you've checked out our website. But we invite you to take the next step into phase two, which is to schedule your free consultation to discuss your specific situation. I'd be honored to work with you, help you walk you through this process, the Medicare maze. And then after phase two, you move into phase three, which is our free lifetime billing and claim services from our client service team. We do pride ourselves on checking in with you when you get your ID cards, birthdays, holidays, when your plan changes, rate increases. You will have no shortage of help from us. And of course, we do offer free annual reviews with your agent to ensure that you're always in the best product for the coming year. So, and again, these are all the different companies. This is just a small sampling of the companies we offer. And I would invite you now to take that step into phase two by clicking on the blue calendar to schedule your call. Again, you can email me directly, ncurry@healthbrokerfl.com. Call or text me 386-401-5644 if you'd like me to send you this slide deck. I hope that we have brought some clarity to the Medicare maze. Hopefully you have a better understanding of what's probably going to be a better solution for you. And I hope you book, and thank you very much for your time. And I'm going to go ahead and end the meeting. I look forward to talking to you.